Hello, students. Today we will explore how Filipino health values, beliefs, and practices shape our approach to health and nursing care. In the Philippine context, health is often viewed as a state of harmony, a balance between the body, mind, spirit, and environment. This holistic concept recognizes that well being isn't only about being free from disease, it is also including the peace of mind, harmonious relationships, and spiritual stability. Culturally competent care begins with understanding the client's worldview. In the Philippines, this worldview blends Western biomedical perspectives with indigenous cultural traditions. For nurses, recognizing this dual influence helps us bridge modern health promotion strategies with traditional beliefs our clients hold dear. The Filipino term kalusugan goes beyond the physical. It encompasses mental, social, and spiritual wellness, a truly integrative view of health. Illness is commonly seen as a form of imbalance among the katawan or the body, the isip or mind, the kaluluwa or spirit, and kapwa or relationships with others. This resonates with the idea of mapayapang kalooban or peaceful inner being. When we apply this in our nursing practice, it means that care plans should not only target physical symptoms, but also address emotional and spiritual well being. For example, allowing space for family prayer or considering emotional distress as part of health assessment. These are forms of culturally congruent practices. In our Filipino culture, illness may have natural, supernatural, or social causes. Natural causes include infections, heredity, poor hygiene, or diet. Supernatural causes include beliefs in kulam or witchcraft, usog or evil eye, lamig or in some dialects, bali. Social causes may include conflict, loss of harmony, or divine punishment. This belief system shows the Filipinos' integrative understanding of health, where physical, emotional, and spiritual factors are intertwined. As community health nurses, we must approach these beliefs with respect and curiosity, not judgment. Asking questions like, ano po sa tingin ninyo ang dahilan ng inyong pagkakasakit? Or what do you think caused the illness? This helps uncover these cultural explanations and build trust. Let's look at examples of folk illnesses and their remedies. We have the pasma. This is believed to be caused by cold entering the body after fatigue and is treated by avoiding cold water and having a hilot or masahe. Usog is thought to result from a stranger's greeting, prevented by saying buyag-buyag or puwera usog or applying salt. Bali or balis are associated with infant colic or fright, managed by massages of coconut oil or any concoction. We also have gaba. This is understood as a curse for wrongdoing and is usually believed to be atoned or relieved through confession or asking for atonement. While these are not medically validated, they reveal deep moral and relational dimensions of Filipino health beliefs. We in the community and as nurses should distinguish between harmless traditional practices which we can integrate and harmful ones which we need to gently correct. Most Filipino families commonly begin treatment at home. First aid often involves herbal and home remedies. Traditional healers like albularyo or hilot are often consulted before a medical professional. Religious healing through prayers, novenas, or anointing is another trusted option. And we have professional help. This is usually sought when the condition worsens. This behavior reflects the layered approach to healing, starting with the familiar and the spiritual, then moving to formal medical care. As nurses, we must understand these patterns to plan effective health education. Our goal isn't to replace traditional practices, but to guide clients toward safe, evidence based care while respecting their faith and traditions. In the Philippine culture or in Filipino families, the family is the central decision maker in health matters. Elders or the most educated member usually decides what treatment to pursue. Values such as hiya or shame and pakikisama or social harmony can influence how patients communicate with health professionals. For instance, modesty may prevent women from discussing reproductive health concerns openly. Understanding family roles is essential in community and family nursing. Nurses should identify who the key influencers are in the family and engage them in health discussions, ensuring the entire family understands the plan of care. For many Filipinos, illness is seen through a divine lens, as God's will, as a punishment, or as a test of faith. Healing rituals such as pagpapausok, prayer meetings, and anointing symbolize the belief that true healing comes from both divine and human effort. Faith communities also serve as valuable partners in health promotion. Churches often assist in medical missions, host vaccination drives, feeding programs, and wellness seminars. We are reminded as community health nurses that religion can be a powerful determinant of health behavior. We nurses can leverage this by collaborating with faith based groups to reach more people in culturally and religiously acceptable ways. Filipino values influence health attitudes and caregiving styles. We have the hiya or shame. This can cause avoidance with medical consultations, utang na loob or debt of gratitude. This promotes reciprocity in caregiving, pakikisama or harmony. This maintains cooperation within groups, and the community spirit or bayanihan encourages collective health action. In practice, these values can either help or hinder health outcomes. We need to know or be reminded the importance of cultural awareness. We need, as nurses, to acknowledge these values to allow us to adapt interventions that fit communities' moral and social fabric. Filipino families are typically extended, with multiple generations living together or close together. This structure creates a strong caregiving network. The bayanihan spirit also strengthens community level health programs as people work together for a common goal. However, this collectivism means decisions are often made as a group, which can slow urgent medical actions. For nurses, the strategy is to use these relationships as assets, mobilizing family and community support for health promotion rather than viewing them as barriers. Many Filipinos rely on herbal medicines such as sambong, bayabas, lagundi, papaya, and tawa-tawa for everyday or common ailments. Massage therapy or hilot, steam baths or suob, and faith healing are also widespread. Importantly, the Department of Health acknowledges these practices under Republic Act 8423 or the Traditional and Alternative Medicine Act, endorsing 10 medicinal plants for safe use. As nurses, we should educate communities on safe herbal practices and guide them to combine traditional wisdom with scientific care. This collaboration is in support of the view of population centered health promotion grounded on cultural understanding. In our country, we need to identify and acknowledge the role of the albularyo and the hilot. In many rural areas, the albularyo and hilot are highly respected. The albularyo uses herbs, oils, and prayers. The hilot specializes in massage and postpartum care. Faith healers combine touch, prayer, and rituals. These healers are trusted community figures who provide not only treatment but also emotional comfort. We are reminded that cultural healers play vital roles in promoting community health. We community health nurses can collaborate with them by acknowledging their influence and sharing health education in a respectful, non judgmental way. Cultural beliefs do not exist in isolation. They are shaped by social realities. In our Philippine context, poverty is a barrier because poverty limits access to quality medical services. We also have education impact. Education affects health literacy and preventive practices. We have geographic disparities. This means rural communities have fewer options. We have what we would call as the unserved and underserved areas. And then we have the modernization effects. Modernization and migration influence how health values evolve. They are also changing the health landscape. These are part of the social determinants of health. As nurses, we address these socio-economic factors by advocating for accessible services, health literacy programs, and equitable resource distribution. Culture has both positive and negative influences to the community, specifically on their health. These are the positive cultural influences. Number one, we have family support. A strong family support promotes recovery. Bayanihan. This fosters cooperation. Faith. Faith strengthens coping in crisis. And then respect for elders. This encourages advocacy and compliance. These positive cultural influences are strengths that can be leveraged in community programs. It is important for us to know and bank on these positive cultural influences so that we can provide effective health promotion by working on the available existing community assets, not just deficits. However, not all cultural traits promote health. We have several negative cultural barriers. Number one, we have the fatalism or the bahala na culture or attitude. This may discourage preventive care. Second is over reliance on folk healers. This could lead to delayed treatment. Another one is hiya. Hiya could result to non-disclosure or not full disclosure of symptoms. And then we have the stigma. This may prevent mental health or reproductive health discussions. Our task as nurses is to balance respect with advocacy, educating clients about evidence based practices while showing empathy and respect for their beliefs. Communication is the heart of cultural competence. As nurses, we need to use respectful language and, if possible, use local dialect when we communicate with our family and community. Second, we need to ensure that we maintain privacy and avoid embarrassment. Avoid asking very private questions, especially so if we have not yet established rapport with our family. That said, we need to build trust through listening and empathetic care. We also need to involve family members not only in treatment but in every session, especially health teaching. Culturally sensitive communication reduces misunderstanding and builds therapeutic partnerships and collaboration, especially here in our context, wherein we are faced with multicultural communities. Now, what are all of this when it comes to our nursing practice in community? First, when assessing clients, nurses should include cultural beliefs and practices in the history taking. We ask about herbs, rituals, traditions, home remedies, and note decision makers within the family. We observe for nonverbal cues like silence, hesitation, or gestures that may carry cultural meaning. This holistic assessment allow us to provide comprehensive family assessment, which is understanding not only health status but also their family's cultural context. During planning, we can integrate acceptable traditional practices and collaborate with barangay health workers or local healers. We can use culturally relevant materials, posters in local dialect, folk stories, or visual aids, and involve faith based and civic groups in health campaigns. This reflects the Philippine Health Promotion Strategic Framework, which promotes culturally grounded and community driven health interventions. Health education must be tailored to the community's literacy level and beliefs. Use storytelling, role plays, or folk examples to make health messages relatable. Reinforce preventive behaviors through community gatherings or barangay events, emphasizing that traditional and modern care can coexist in harmony. Effective teaching is participatory and contextualized, encouraging individuals to take ownership of their health. Ethically, nurses must respect autonomy and avoid ethnocentrism. Our goal is to educate and not impose. We respect autonomy and beliefs while ensuring safety, and we avoid ethnocentric judgments. We must also align with RA 8423, ensuring traditional practices are safe and evidence based. Culturally competent care is both a moral and legal obligation for nurses in our country. In summary, Filipino health beliefs and practices provide both challenges and opportunities in nursing. Our role as community health nurses is to honor these traditions while guiding families toward healthier choices. By understanding the Filipino worldview of health, which is rooted in balance, faith, and community, we become not just caregivers, but bridges between culture and science, tradition and modern care.